Hi, my name is Sarah. I'm going to be your student nurse practitioner today, performing your respiratory exam. I just kind of want to go over what that exam entails.
Okay.
So basically, the gist of it is that I'm obviously going to look at your chest, the front and the back. I will be doing some light touching and also some tapping,
Okay.
as well as listening. At any point that you feel pain, please tell me. We can stop, as well as I'm going to be having you take some deep breaths, and if you start feeling breathless, let me know. We can take a break as well. Okay? All right. So looking at your chest on the front, you have pretty good posture as well, but you don't have any like congenital defects like a supernumerary nipple. You don't have any superficial venous patterns that could be indicative of another disease process. And then also, I don't see any masses just by looking. And if I go to your back side, your spine looks pretty straight to me. Thoracic spine looks straight. I don't see any masses just kind of popping out at me. I'm just going to go ahead and start lightly touching your back, okay? Please let me know if you have any pain.
Okay.
Okay. I'm not feeling any masses or depressions. Do you have any pain?
No.
Okay, so no pain. I'm not feeling any crepitus as well, or rubs. And I'm going to go ahead and try to look at your expansion of your lungs when you take a breath, okay?
Okay.
So I'm going to place my hands here.
Okay.
And then, can you take a deep breath in? Okay, and then go. Okay, so your breath expansion, your lung expansion is symmetrical on both sides.
Okay.
Next, I'm going to have you say the word 99 as I touch your back.
Okay.
Okay.
99.
Okay.
99. 99.
Okay. So I feel the vibrations equally on both sides. I'm not really concerned of consolidation based off that at this point.
Okay.
Next, I'm going to have you say the word E as I listen to your back as well.
Okay.
Alrighty, go ahead and
E.
Yep.
E.
Okay.
E. 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 E.
Alrighty, and now I'm just going to take a listen to your breath sounds. So
Okay.
let me know if you need a break. Okay. Doing okay?
Mm-hmm.
Alrighty, can you cross your arms in the front for me? And I'm going to just listen to your sides, okay? There are 2 spots over here and 3 spots over here.
Okay.
Okay. Take a deep breath. Okay. 2 more times. Okay, 1 more. Good. So your breath sounds, they sound clear to me. I don't hear any adventitious sounds. That would be concerning. Going to your front side now. Let's take a look here. I'm just going to go ahead and palpate the front again. Okay.
Okay.
Let me know if you have any pain. Okay. Any pain?
No.
Okay. I don't feel any masses, depressions, or any like bone abnormalities that would be concerning. I'm just going to lightly pinch your clavicle here. Okay, skin turgor is present. You seem to be well hydrated and have good nutritional state. Next, I'm going to just take a listen to you here as well.
Okay.
And then the last thing I'm going to do is I'm just going to go to your back and do a tap like right where your kidneys are.
Okay.
We use this to test if you're having muscular pain, whether it's maybe from your kidneys rather than muscular. Okay. All right. Do you need a break for
Nope.
breathing? Okay. Okay. Here we go. All right. 2 more times. Okay. You feeling okay? Last one. Okay. Breath sounds in the front are clear. I don't hear any adventitious sounds like a wheeze or any crackling.
Okay.
Last but not least, I'm just going to take a trip back here, and I'm just going to have you turn this way a little bit for me.
Yeah.
Thank you. And then I'm just going to lightly hit. Okay.
Okay.
Let me know if you have any pain. Any pain?
Nope.
Okay.
Nope. Nope.
Okay. Alrighty. Thank you. Hi, my name is Sarah. I'm going to be your student nurse practitioner performing your cardiac exam today. Throughout this exam, I will just inspect your chest. You'll probably be laying down for a second. I will be doing some light palpation and listening, okay, with my stethoscope here. So first, just kind of looking at your chest here, I do not see like an abnormal diameter of your chest. Your transverse diameter is greater than your anterior posterior diameter. I don't see any just by looking at you right now in this position. You have good posture, and I do not see any lifts or heaves or pulsations or abnormal depressions or elevations. But if I have you lay down for a second and take a look at you here. So at this angle or elevation, I do not see any pulsations, maybe minorly your aorta. I do not see any abnormal pulsations or any pulsations at your point of maximal impulse, which is also normal, especially with people who have more musculature than others who aren't as thin. And I do not notice any abnormal depressions or elevations. So if I go ahead and just begin to palpate his chest, I'm looking to palpate at the aortic space, the pulmonic space, Erb's point, tricuspid area, and then also the mitral area. So what I'm doing here is I'm looking for the ribs, and I'm going to this second intercostal space on the right-hand side of his chest here, and I'm looking to see if where I place the tips of my finger, if I get any lifts or heaves. And I'm going to repeat this on the other side of his chest as well. Here at the pulmonic area, so I'm looking for any lifts or heaves, and I have not found any lifts or heaves at his aortic area or the pulmonic area. And then going to his Erb's point, where S1 and S2 are, I do not feel any lifts or heaves. And then to his tricuspid area, I do not feel any lifts or heaves. And then also if we go down to his mitral area or the point of maximal impulse or the apical pulse here, I do not feel any lifts or heaves, nor do I feel any thrills. I do feel that his pulse is gentle and brief here as well. And then if I have you sit up, I'm going to listen to your chest, or your heart, really. And I'm going to listen in these same areas. These areas here. I'm going to first listen with my diaphragm of my stethoscope. And what I'm doing here is looking for the second intercostal space to the right of the sternal border here. and I'm looking for like murmurs or clicks from the valve here. And then if I go over to the left side of his chest, to the second intercostal space, I'm listening to the pulmonic valve, and I'm also looking for murmurs or clicks, which he does not have at either of these spaces so far. And then if I go down to the third intercostal space left of the sternal border, I'm at Erb's point, listening to S1 and S2. I do not hear any murmurs or clicks. I also do not hear any extra heart sounds like S3 or S4. And then if I go down, if I inch down, or I can also go down and feel to the fourth intercostal space, which is the tricuspid area, I'm listening to clicks, murmurs as well here, and I do not hear any. And then if we go back down to the mitral space, or the apical pulse, I'm listening for clicks, murmurs. I don't hear any of those. Don't hear any extra hard sounds as well at this point. And then if I switch over to my bell, I'm going to redo this process, listening to lower pitched sounds, like lower pitched murmurs. Okay, no clicks or murmurs noted at the aortic space. Pulmonic area does not have any clicks or murmurs. Erb's point, I don't hear any clicks or murmurs as well. The tricuspid area, no murmurs or clicks. And then the mitral valve area, no murmurs or clicks as well. If I were to count your heart rate, I'm going to set a timer here, or I guess I can just look at my phone. Okay, I got 80 heartbeats, okay, per minute, and that is our respiratory or cardiac exam.